Good morning, everybody. Am I audible and visible? Just a second. Am I audible and visible, guys? Okay. So, hope everyone is doing good, healthy, and happy. Just let me share one thing. Okay, so today you have a class on demography and contraceptives. So I'm going to start with that, everyone. So I'm going to give you the first question. Okay, we are done with epid, vaccines. We have demo and contraceptives. Just do this first question. I am just volume is low. Okay. All right, now it's okay. Chalo. So do this first question, and I'll just come in a while. Okay, just start with this question. I'm coming. Alright, what is the answer to this one, everybody? Which of the following statements is true about sample registration system? It is the only dual record system. It has completed 4 rounds. It's undertaken once every 5 to 6 years. It mandates birth, death and marriage registration. Now, what is the correct answer to this? It is the only dual record system. Alright, SRS is the only dual record system. Please remember, SRS is the most efficient health information collection system in India. Who has completed 4? In fact, now who has completed 5 rounds? If I ask you in the comment section, who has completed 5 rounds? Good morning, everybody. Who has completed 5 rounds? So NFHS has successfully completed 5 rounds. NFHS is the one which is undertaken once every 5 to 6 years. And what mandates birth and marriage registration? So the correct answer to this is, what mandates birth and marriage registration? It is civil registration system. And according to civil registration system, the birth and death should be registered every 21 days. Alright, I mean the time limit to register is 21 days. Marriage, it could be 30, 60, 90 days depending on the state. But remember all these points, civil registration system, guys, is the least efficient health recording system, health information collection system. Okay, moving to the next question. Let's see this one. Dual recording system will provide data on. Now, this is another form of asking you that dual recording system is going to provide you data on. Dual recording system is going to provide you data on. Now, what is dual recording system, everybody? We know dual recording system क्या होता है? Yes, NRI. Yes. ठीक है, dual recording system क्या होता है? We all know dual recording system is SRS. Now, out of this, which data does SRS provide us on? Population pyramid, literacy rate, sex ratio, crude death rate. So remember, it is crude death rate. What are the information most expected from health information collection system, guys, is SRS. Okay, and SRS provides you data on, remember अभी latest SRS का data भी आया था, CBR, crude birth rate, crude death rate, infant mortality rate, infant mortality rate, maternal mortality ratio, and of course annual growth rate of a country. These are the 5 things. Current CBR is 19.3 per thousand mid-year population. Earlier it was 19.5. The current crude death rate is 7.5 per thousand mid-year population. Alright, so the values have kind of changed. IMR 27. MMR now it is 93 per 1 lakh live births. Okay, so that I will give you when we have a numerical class, all the latest information also. Literacy rate, sex ratio, all this information you can get from census. Alright, anybody has any doubt, just keep noting down. Easy question. Which ministry is responsible for conducting census in India? This is also a PYQ. Which ministry is responsible for conducting census in India? Which ministry? Is the voice okay? Is responsible for conducting census in India? I think the voice is fine. Yeah, Ministry of Home Affairs. Out of the ministries, this could come in your exam, Ministry of Home Affairs. Ministry of Home Affairs is also responsible for disaster management. It is also responsible for disaster management. When you talk about disaster, the houses are disrupted. When you talk about census, you have to count the houses. So Ministry of Home Affairs is disaster management as well as census. Okay? Yes, the chairperson for census is census commissioner. The chairperson for census is census commissioner. But the chairperson in case of disaster management, is the prime minister. All right, chalo. NFHS is conducted by which institute? Just trying to give you a basic couple of questions, then we'll go to the conceptual topics as well. NFHS is conducted, Health Information Collection System. I'm trying to give you the questions that could come in your exams. NFHS is conducted by which institute? National Statistic Sample Survey, Ministry of Health, Family Welfare, International Institute of Population Sciences, Directorate General of NFHS is not the main body to conduct NFHS. Most of you, all of you in fact are marking me. No guys, International Institute of Population Sciences. So Mayank and Shravya and SS are the few ones who got it correct. It does take help of Ministry of Health and Family Welfare, but the main body conducting NFHS is International Institute of Population Sciences. Alright, this can come. NFHS is very important. NFHS 5 rounds completed. NFHS 5 rounds completed. It is conducted once every 5 to 6 years. दूसरा ये इसकी ministry है. This we have also discussed in our RR videos as well. International Institute of Population Sciences. This is the logo guys. International Institute of Population Sciences. इसका headquarter Bombay में है. इसका headquarter is in Mumbai. Alright, the headquarter is in Mumbai. चलो. See, SRS and CRS, they are all under civil registration system. NFHS is IIPS. Census is Ministry of Home Affairs. Let's move ahead. Now we will talk about a couple of fertility indicators. So you just have to keep answering over here. What is net reproduction rate? Think and answer. I just want to revise all the buzzwords over here. So if the question comes, net reproduction rate, number of children a newborn girl has in a lifetime, number of female children a newborn girl has in a lifetime, number of male children a newborn girl has in a lifetime, number of female children a newborn girl has in a lifetime taking into account mortality. Very good. It is mortality. What is this one? Number of children. When you see the buzzword children, a reproductive age woman will have children from 15 to 49 years. Reproductive age woman. Okay, how many children she is going to have? So the buzzword is TFR. Children mate is TFR. If I only ask you female children or if I ask you girl child, it will be gross reproduction rate. But when we consider mortality, please remember how many girls are going to remain alive. So if I talk about mortality dependent fertility indicator, mortality dependent is net reproduction rate. Mortality dependent is net reproduction rate. Most sensitive indicator of achievement of family planning services. Most sensitive indicator of achievement of family planning services. Most sensitive indicator of achievement of family planning services. What is the answer to this? Most sensitive indicator of achievement of family planning services, also NRR. ठीक है, mortality dependent NRR. सबसे sensitive indicator achievement of family planning services NRR. Family size indicator of complete family size. If you talk about complete family size, that is guys TFR, total number of children. ठीक है, अभी we'll discuss GFR and all that. Now GFR आ गया. बोलो धनंजय इसका आंसर. What is this, guys? General fertility rate is, now what will you mark? Number of live births in a woman in reproductive age 15 to 44. You said 44, 49. That's okay. Number of live birth in unmarried woman in age group. Number of children a woman would have if she were to pass through her reproductive years. Number of abortions usually per 1,000 women of childbearing age. Now what is general fertility rate? It is number of live births. देखो, let me just revise it. You have crude birth rate. What is crude birth rate? Number of live births per 1,000 mid-year population. Now in mid-year population, you're going to have males, you're going to have children. Everybody cannot give birth. So we made it a little specific. How? Number of live births per 1,000, we said women in reproductive age group. Women in reproductive age group. So women in reproductive age group means 15 to 49 years. So what is this? General fertility rate. Now out of the women in reproductive age group, again, who is more exposed to giving birth? An unmarried girl of 20 years or a married woman of 25 years? Obviously a married woman of 25 years. So we made it GMFR. What is that? Total number of live births per 1,000. What did we write here? Married women in reproductive age group. Married women in reproductive age group. Clear? You just have to go by this. Crude birth rate, live births per 1,000, mid-year population. Everybody in mid-year population is not exposed to giving birth. So we came to women in reproductive age group. That is general fertility rate. Now out of women in reproductive age group, who is more exposed to giving birth? The married woman. So what did it become? Live birth per 1,000 married women in reproductive age group. Am I clear? You never seen unmarried, you always seen married. And TFR, children. GRR, girls. Net reproduction rate, girls considering mortality. Okay? Let's go to the next question, guys. True about GFR is. Let's see if you can answer this. True about GFR is. What is your answer here? Good. This is a PYQ, guys. Now see, of course, complete family size is always TFR. What is complete family size? Complete family size is the total number of children. Total number of children a couple will have from 15 to 49 years. Is it not better than crude birth rate? This is false. In crude birth rate, I just now told you, the denominator is mid-year population. And in GFR, the denominator is live births per 1,000. Women in which age group? Women in reproductive age group. So, of course, GFR is a better measure. It's not better, it's better measure. So, what is the correct answer? These are all fertility indicators. Please don't mark all of the above everywhere, because most of the times, some of the times, of course, all of the above is answer, but not every time also. ठीक है? चलो आगे बढ़े. चलो answer to have tried to put in all the PYQs from this topic from different exams, guys. Gross reproduction rate is, just try to remember what was the buzzword that I told you. What was the buzzword for gross reproduction rate? What was the buzzword? Gross reproduction rate is girls. Khatam. Number of girls born to a woman throughout her throughout her reproductive lifespan. Alright, number of girls born to a woman throughout her reproductive lifespan. Total children, if you have boys, as such we don't have any indicator. Total children would be TFR. Number of live births per 1,000 women of reproductive age group, this is GFR. I hope now you've understood it. Alright, what is the answer to this? Last question from this topic. Average number of children a woman would have if she were to pass through her reproductive years bearing children at the same rates as women now in each age group is known as. So what is the word that is buzzing to you over here? Buzz. What is the buzz over here? The buzz is children. Children means total fertility rate. Okay. Gross reproduction rate means girls. Net reproduction rate means we are considering what? We are considering mortality. Clear? Total number of children 15 to 49 years. So it is general total fertility rate. Now guys, one more thing I forgot to discuss. Please remember, for a country's population to stabilize, what is the desirable TFR? For a country's population to stabilize, what would be the desirable TFR? किसी भी country के population को stabilize होने के लिए desirable TFR कितना होना चाहिए? 2 या 2.1? Remember, it is 2.1, not 2. This 2 and 2.1 are almost the same. It means the country has achieved what? 2-child norm. And when will I say that 2-child norm 2.1? If I say TFR is 2, that means how many are girls? By law of probability, 50% should be girls. If suppose a family has a TFR of 4, that means total children, 4 children. So out of them I ask you, can you tell me GRR? GRR क्या हो जाएगा? Half of that. So by law of probability, 4 by 2, which will be 2. So if TFR is 2.1, this is possible when NRR, net reproduction rate, will be equal to 1. That means out of the 2 children, 1 is the girl child. And when will this happen that couples are having 2 children? The 2-child norm on an average has been adopted for the country when at least 60% couple protection rate or contraceptive prevalence rate, everybody, is more than how much? It is more than 60%. That means in any country, more than 60% of couples are protected or are using a family welfare approved family planning method. And what do you mean by NRR equal to 1? Equal to 1 means replacement level fertility. What is replacement level fertility? That means that a woman will replace herself with 1 girl child. Alright, so on an average, if every woman replaces herself with 1 girl child, मतलब एक woman की एक लड़की ही हो रही है, what is going to happen to the population? It will stabilize. But when NRR is more than 1, a woman is replacing herself with more than 1 girl child who will survive till the childbearing age. This is above replacement level. So population will expand or population is growing. And when NRR is less than 1, the population will decline. ठीक है, these are some common terms that you must know. And India का current value क्या है? Anybody? India. Please remember, the current TFR in India is 2. Alright, and contraceptive prevalence rate is 66.7%. That means 66% of the couple, almost 67%, are using a contraceptive method. But exam may be very careful. If they ask you desirable TFR, that is 2.1. All the one-liners we will be doing in our, all the one-liners will be taken up on PrepLadder's YouTube channel also, guys, on the 4th of June, which will be good for NEETPG students also and FMG students also. It will be a 2-hour session, 100 one-liners we will do for PSM. Chalo, all are features of the following population pyramid. Now, population pyramid might turn up. Of course, RM and CH plus Eka class hoga, don't worry, it's in the roster. Check out the roster, Prahlad, you will find it. Okay, what is this? Now, this is a developing country. Whose pyramid it is? It is the pyramid of a developing country. When I talk about developing country, you have a broader base. Why? See, pyramid represents age group, like lower child, beach mein working class, and above elderly. So if you have a broad base denotes more fertility, poor family planning. It is an expanding type of pyramid. The population is expanding, alright. It is asymmetrical. Because not ideal sex ratio. Asymmetry over here represents the ideal sex ratio. यहाँ पे ideal sex ratio नहीं अभी achieve हुआ है, ठीक है. Developed countries में you will have symmetrical. Is it downward triangle? Do I draw a triangle like this? No. I will first draw population, child population, I'll draw working class, and I will draw the elderly. So this is incorrect. What is it? It is nothing but upward triangular. It is nothing but upward triangular. ठीक है. So just have a look at this image. This image right here is for developed and developing. This guys is for developed countries. This one is for developed and this one is for developing. So we all know narrow base is for developed because poor fertility, low fertility, good family planning. Here it is broad base. Which one is taller? Developed is taller. Why taller? Because more life expectancy. People are going to live longer. Here it is shorter, lower life expectancy. People would live, let's say in India, 67.9 years. So on an average, people will survive till that age. Beyond that, the accumulation of elderly population would be less. Therefore, if you talk about the apex over here, it is acute. Fewer elderly, but here the apex is obtuse. Why? More elderly. This one symmetrical. Why symmetrical? Ideal sex ratio. This one asymmetrical. Why? Not ideal sex ratio. Plus अगर आप population pyramid के देखोगे, developing is expanding, but this one developed is constricting. Somebody is constricting it like this. You can also call it as spindle shaped. Alright, you can also call it as spindle shaped. Got it, everybody? Symmetry over here refers to the sex ratio. Symmetry over here refers to the sex ratio. Yeah, European countries developed है, ठीक है? Most of the, like, we are going to study the stages now, so we will discuss about that. Community X has 30% below 15 years of age and 10% over 65 years of age. Dependency ratio for community X is 20%, 40%, 66.6%, 3%. रवि, अपवर्ड ट्राइंगल का मतलब होता है ना, पॉपुलेशन पिरामिड 3 एज ग्रुप रिप्रेजेंट करता है, चाइल्ड, वर्किंग क्लास, एल्डरली. सो पॉपुलेशन में सबसे पहले आप क्या बनाओगे? द फर्स्ट थिंग यू विल मेक इज अ चाइल्ड पॉपुलेशन. सो इट्स गोइंग अपवर्ड, वर्किंग क्लास, देन एल्डरली. सो अपवर्ड ट्राइंगुलर. यू विल नॉट स्टार्ट फ्रॉम एल्डरली एंड कम टू चिल्ड्रन. यू विल गो फ्रॉम चिल्ड्रन, वर्किंग क्लास, एल्डरली. अब समझ में आया रवि? ठीक है. Chalo, now this dependency ratio was asked in NICT also recently. So it's an important question. Dependency ratio means children who are below 14 years plus elderly above 65 years. Now even if they give you 60 years, that's okay. In certain countries like in India, the cutoff for elderly is 60 years. Okay, and the population 15 to 64 years is the working class. Now 30% are below 15 years. So how many are below 15 years? You can say 30. And 10 are over 65 years. So 10. So if you look over here, who are the total dependents over here? The total dependents are 40. Right? Now what is the working class? How much will be the working class? 100 minus 40, which will be 60. So it will be 60 into 100. ठीक है, because it's expressed in percentage. So 40 by 60 into 100. What will your answer come? Yeah, 66. Yes, 66.6% dependency ratio. This is young child dependency and this young age dependency. Elderly above 65 years क्या हो जाएगा? Old age dependency. Clear? Chalo, remember this calculation is important. It just got repeated in NICT as well. It has also come in FMG exams. Okay, now suppose they give you a question where they write a story. Mr. Ram has 67 years old. Mr. Ram की wife 57 years old है. उनका एक बेटा है 35 years old. He has a wife 8 years old. They have a son 5 years old. So just look at the age group, figure out the total number of dependents, figure out the working class and accordingly calculate. Okay? Chalo. Working class means the rest of the population, not below 14 and not above 65 years. Okay, Sirat? All right, anything you don't get, just copy, just note it down, I'll tell you. What is the answer to this? The major contributor to demographic burden. Now there are two terms, demographic burden and demographic bonus. What is it? Now see, if you talk about bonus, if you talk about burden, all right, how will you remember it? What is bonus, guys? Bonus means some advantage, something useful. So what is the bonus over here? Decline in dependency ratio. Burden means kuch bhar, kuch pressure. I have some burden on me. So what is the burden here? It is increase in dependency ratio. The burden is increase in dependency ratio. The bonus is decline. The burden is increase in dependency ratio. Now when you have to talk about the decline, why is there a decline? Because of decline in young age dependency. Decline in young age dependency. All right, decline in young age dependency. Why? Because fertility rates are डिक्लाइनिंग, फैमिली प्लानिंग इज इम्प्रूविंग. बर्डन, मूवीज में देखा है ओल्ड एज को बर्डन मानते हैं जस्ट फॉर द सेक ऑफ रिमेंबरिंग. प्लीज डोंट कंसिडर देम एज बर्डन. सो इंक्रीज इन डिपेंडेंसी रेशियो इज ड्यू टू इंक्रीज इन old age dependency. All right, and when do you see bonus? Bonus is seen from stage 3, jab sabse pehle, for the first time when birth rate declines, and burden is seen in stage 5 when you have more elderlies, when the birth rate is below death rate. Clear? So just remember like this: bonus, decline in dependency, burden, increase, kuch pressure. Why is there increase in dependency ratio? Because of increase in old age dependency. Why is there a decline in young age dependency? Because of lower fertility rates. So here the answer is increased old age dependency. There are a couple of other definitions I will show you. Let me finish this one, and then I have a couple of this thing, I will show you a couple of more definitions. Okay, let me wrap up, then I'll show you. All right, which is not a demographic process? What is your answer? Trap is stage 2. We are going to the this thing, we are going to the different stages as well in just a while. Which of the following is not a demographic process? Demographic process means something that governs demography, population. Why is it growing? Why is it declining? So what is this? Morbidity. Very good. Morbidity I will teach you when I have a screening class, where I will teach you concept of health and screening together. Morbidity is burden. Okay, now the growth or the population is affected by, imagine like this, there is a couple gets married, so marriage. After marriage they have children, fertility. After children, what happens? They decide to migrate to some other country thinking that they'll grow more rich there. They might grow poor also. So they can either grow poor, they can either grow rich. So that is social mobility, movement at socio-economic levels. And ultimately it is mortality, not morbidity. So you can just remember this theory. ठीक है, morbidity is burden, incidence, prevalence. That is what is morbidity. We will discuss mortality, morbidity, disability indicators, so don't worry. Okay, please do this. I'll just get some tea and come do this question. लिख लिया सबने? What is the correct sequence? Guys, ideally we will not say cycle क्योंकि question में it's not exactly a cycle. What is the name of this, guys? Demography transition model. So what have you written, most of you? A. Okay, let's see. High stationary, early expanding, late expanding, low stationary, declining phase. Very good. Now what happens in these phases? We need to revise. So let me give you a question, then we will revise. Okay. Alright. Tell me the answer to this. Identify the correct statement about Indian demography transition model. The question is Indian. Alright, I will speak. Yeah, I think I'm speaking mostly in English. Okay, I'll try to stick. If anybody doesn't get it, you can just let me know. Alright, identify the correct statement about Indian demography transition model. Think and answer this, guys. Indian demography transition model. Now you all know India is in the late expanding phase. India is in the late expanding phase. Let us quickly revise the demography transition model. Now what happens in the first stage? You all know it is governed by CBR and CTR. What is happening now? The country has just come into existence. Births high, deaths high. Births high, alright, deaths high. So what is happening if births high, deaths high? Population is stable. This is known as high stationary. Births are high, deaths are high. Population is stable. This is what? High stationary. Population kya hai? Stable. Then what happens, guys? The first we are concerned about saving the lives of the people, increasing life expectancy. So death starts to decline. Death starts to decline. Birth still high. Birth still high. So what is happening? Population is expanding. This is early expanding, and this is the worst phase, guys. Population is expanding at a faster rate. It is also known as population explosion. What do you call it? Population explosion, or the country is trapped. Okay? What is the third stage? Deaths continues to decline. Deaths continues to decline. It declines even further. Life expectancy increases more. For the first time now we are concerned about family planning. So births starts to decline. Births for the first time starts to decline now. So this is what the population is expanding, but it is what? Late expanding. It is growing at a slower rate. Ultimately, birth and death are low. Low, low. This is one of the most desirable phases. Low stationary. Okay, first one was high stationary. This is low stationary. Ultimately, births are below death rate. Death has become very stable, or it's declining at a very stable, slower rate. So what is this? Declining phase. This is declining phase. Am I clear, everybody? This is declining phase. Now if somebody asks you, where do you see the highest birth rate? Where do you see highest birth rate, guys? सबसे ज़्यादा birth rate कहाँ है? Highest birth rate हमेशा, always. Where do you see highest birth rate? Always in stage 1. When does the birth rate starts to decline for the first time? Starts to decline in stage 3. Okay, which is the most undesirable stage? Undesirable stage 2, because it's a trap. Okay, it's undesirable. And which is most desirable? It is low stationary. Most desirable is low stationary. So I asked you, alright, a worst phase is the stage 2. Nobody wants to be in a trap. So I ask you, identify the correct statement about Indian. Indian is late expanding rate. So what did you write for this, everybody? Birth rate is lower than death rate. Death rate, is the birth rate lower than death rate, guys, in India? No. Death rate declines still further and birth rate tends to increase? No. Death rate declines still further and birth rate tends to fall also. Yes. High birth rate, high death rate, that is stage 1. So what is the correct answer over here? Stage 3. Okay? The correct answer is stage 3. Desirable matlab which stage a country would want to go in. So every country doesn't want a declining population considering today's time. We desire a stage 4. And the countries don't want to be in stage 2. Like African countries, they are in stage 2. Okay? Everybody? Chalo. Let's go ahead. Look at this. Late expanding stage of population in India is due to. Now another way of asking. Late expanding stage of population in India is due to what? What would you write over here? Now see. The birth rate sometime was 30. Death rate sometime was 30. Now it is 19.3. Now it is 7.5. So you can see that both are declining. but the rate at which deaths are declining is faster than the birth, or you could say the birth rate is declining slower than the deaths. So what is the correct answer over here? Birth rate declines, death rate remains same? No, death rate declines faster than the birth rate. India is in late expanding because deaths are declining faster than the birth rate. Okay, all right. Demographic gap is maximum in which stage? Let us do an image based question. Demographic gap. Demographic gap क्या होता है? So remember, demographic gap होता है CBR minus CDR. The gap, alright? So it is maximum in which stage? Late stage 2. Okay, so let me just go straight away to the image. This image is a very important image. In FMG exams, they asked the name of this image. So name of the image is Demography Transition Model. ठीक है? NEETPG exam में they asked you to label it. Like they give A and B. What is it? So A is what? This one right here is, alright. What is this one right over here, everybody? The CBR. Alright, and CB और नीचे वाली लाइन क्या है? ये इसको कर दो. And this नीचे वाली line over here is what? CDR. Okay, A is this and this one is CBR and blue line is CDR. Clear? Now what is happening? Where is the demographic gap minimum? So where is it minimum? We know demographic gap is CBR minus CDR. So where is it minimum? In stage 1 and stage 4. Where is it maximum? When the birth rate is still high and death starts to decline. So ये gap देखो, in stage 2 the birth rate is still high, deaths गिरने लगते हैं, death starts to decline. So can you see this gap, everybody? This gap is increasing. Where is it maximum? In the late part of stage 2. Late stage 2. Late stage 2. And when does it starts contracting, guys? When does it starts contracting? For the first time, births, where do they start declining? Over here. Birth starts declining over here. Early stage, yeah, early stage 3. And where is the demographic gap? Negative. CBR is below CDR. It is none other than stage 5. Okay, just remember the name of this model. Remember the markings, CBR, CDR. Remember demographic gap is CBR minus CDR. So you could be asked, where is it minimum, where is it maximum? And they have been asked in different exams, whether it is INI, whether it is NEETPG, whatever exam, they have given this question to be asked. Alright? Chalo. Let's go to another MCQ for the day. While conducting a study in a town, crude birth rate calculated was 32 and crude death rate calculated was 21. What is the current annual growth rate of this population? What are you going to do? What is the annual growth rate? How do you predict annual growth rate? What is the formula for AGR? You must know CBR minus CDR by 10. Okay? So what is the crude birth rate given? 32. What is the crude death rate given? 21. Right? So this is going to come out to be how much? This is going to come out to be 32 minus 21. Yes, 11 by 10. So what is this? 1.1%. Just wanted to revise this formula. CBR minus CDR by 10. इंडिया का करंट एनुअल ग्रोथ रेट 1.19 हो गया गाइस, ठीक है, 1.19 हो गया. जस्ट रिमेंबर दिस फॉर्मूला. ओके, moving to the next MCQ. Alright, now we come to family planning. Do you know what is Nishchay? Anybody in the class knows what is Nishchay? Wanted to discuss since we're now come to contraceptives. I'll talk about Malthusian. Just give me some time. Malthusian is not that important. Let me finish. I'll tell you about Malthusian and the other definitions. ठीक है श्वेता, बताऊंगी Malthusian. Don't worry. Nishchay क्या होता है? UPT kit provided free by ASHA worker. UPT kit provided provided free by ASHA worker. Alright, Nishchay. Nikshay is TB. Nikshay is TB. Nikshay is web-based software for TB patients, surveillance of TB. And what is Nikusht, everybody? Nikusht is leprosy. Nikusht is what? Leprosy. Nikusht is for leprosy. Nikshay is for TB. ठीक है, चलो. व्हाट इज मिशन परिवार विकास? मिशन परिवार विकास क्या होता है? मिशन परिवार विकास इज वी आर टेकिंग इनिशिएटिव्स लाइक वी हैव समथिंग नोन एज नई पहल. We have something, I'll show you the image. We have something known as Sarthi. I'll show you the image. Let me take you to the image. See, this is Nishchay free UPT kit provided ASHA workers. Look at this. I'm zooming this. This is Mission Parivar Vikas, guys, in which we had newer contraceptives made available till sub-center levels. What were the newer contraceptives? Can anyone name the newer contraceptives? Antara and Chaya. Antara was injectable DMPA, alright, and Chaya was centroman. They were made freely available till the level of sub-center. Nai Pehal is what? Family planning kits for newlyweds. We give newlyweds family planning kits. Saas Bahu Sammelan is to improve relationships between the mother-in-law and the daughter-in-law. What is Sarthi? It's a family planning van. Alright, so you can get this question. Sarthi is in Mission Parivar Vikas. It's a family planning mobile van. So these are certain key initiatives under Mission Parivar Vikas. So that we have discussed. And one more thing, Jan Sankhya Sthirta Kosh. This is National Population Stabilization Fund. To keep the population under control, we have a National Population Stabilization Fund, guys. This is known as Jansankhya Sthirta Kosh. Gather approach kya hai? I hope you all remember. It is for contraceptive counseling. We will discuss this again in health communication. G means greet the couple. Greet the couple. A means ask them what they want. Ask them. T means tell them what will be good for them. H means help them choose whatever contraceptive they want. E, suppose they selected OCP, so explain to them. And R means return to follow up. Alright, return to follow up. Return to follow up. Clear, everybody? So these are some initiatives under the family welfare program. The 4. This is Jansankhya Sthirta Kosh, the National Stabilization Fund. Okay. Yes, Antara Chaya Parivar Vikas, it is included because it is written newer contraceptives is a part of Mission Parivar Vikas. Now any question, just keep it with you. I will answer it towards the end. Let's have a couple of contraceptive questions now. We have 15 minutes. What is this? A woman underwent an IUCD insertion in a PHC. What is she most likely to report in the future? What is the answer? Most common side effect of IUD insertion, we all know, bleeding. And in this case, you just have to reassure the woman. Reassurance. Please don't immediately take out the contraceptive. Reassurance. Put her on iron tablets for 2 to 3 months. The second most common side effect is pain. Second most common side effect, if anybody asks you, second most common side effect is pain. And pain is the most common cause of removal of IUD. Most common cause of IUD removal. Most common cause of IUD removal is pain. Pain बहुत ज़्यादा हो, you will have to remove the IUD. ठीक है, let's go to the next question. Choice of contraception for a newly-wed couple is. What is your answer? Choice of contraception for a newly-wed couple. Newly-wed couple के क्या prescribe करोगे? Condoms, combined OCPs, copper T, DMPA injection. Go for terms of failure rate. Lower failure rate is of combined OCPs. Okay, in terms of failure rate. So lower failure rate is of this. Newlywed healthy couple, we go for combined OCPs. If they are not healthy, if she has some problem, heart problem or something, we will go for a barrier method. But if she is healthy, we will go for combined OCPs. Okay? Alright. OCP can be advised safely to a woman in which of the following conditions? Anybody? Breast cancer, congenital hyperlipidemia, liver disease, PID. Very good. PID, OCP, breast cancer, no. It increases the risk of OCP, increase risk of two cancers. Breast, we see breast and cervical cancer. It is protective for, remember, it is protective for endometrial ovarian cancer. Protective for endometrial and ovarian cancer. ठीक है? So इसमें नहीं. Hyperlipidemia, altered metabolic problems, okay, due to progesterone. Liver disease, it precipitates liver cancer. It can be safely given in PID. Current PID, absolute contraindication for IUCD, absolute contraindication for IUD, but you can definitely give OCPs. ठीक है? All right. So look over here, absolute contraindication of OCP, remember CULT, breast and genital में आ जाएगा cervical cancer. Cardiac abnormalities is due to estrogen content. Congenital hyperlipidemia, altered metabolic disturbances, progesterone की वजह से. So these are C. U, undiagnosed abnormal uterine bleeding. फिर liver disease, L, thromboembolism, past or present. These are our absolute contraindications. Relative contraindication, if you talk about any woman who is more than 40 years, any woman who is smoking an age over 35 years, mild renal disease, epilepsy, ये सब relative है. More important is absolute contraindication. Okay? Tell me the answer to this. Which of the following statement is incorrect about the given image? Can you mark it? Contraindications आता है guys, ठीक है? Adverse event भी आता है. We'll talk about it. So increases risk of endometrial cancer. Provided free of cost under National Family Welfare Program. Contains levonorgestrel 0.15 milligram, ethinyl estradiol 0.03 milligram. Protects against benign breast disorders. पहले सबने D क्यों लिखा? अब भी मैंने बताया incorrect. What is incorrect? Does it increase risk of endometrial cancer? No. It is protective for endometrial and ovarian. All these are correct. It is provided free. Mala N. N मतलब याद कर लो, no cost. It is provided free. It contains estrogen, progesterone, ethinyl estradiol 0.03 milligram and levonorgestrel 0.15. You will not forget these values. Protects against benign breast disorders. That is correct, but it increases the risk of breast cancers. But it protects from benign breast disorders. Okay? And this is the family planning logo. India was the first country to start family planning program. And which OCP is provided at a minimal cost, guys? See, if you talk about Mala N is provided freely, but this Mala D, same composition, everything is same. Levonorgestrel 0.15, ethinyl estradiol 0.03, but it is provided under social marketing scheme at a minimal cost of ₹3 per strip. Okay, Mala D. If you go D for Dukan, if you go to Dukan, you have to give money. That's how you can remember it. Okay. Alright, let's have a look at this. A sexually active woman has been using today's sponge as a contraceptive. All are correct statements except. Contains spermicide, non-oxanol 9, should be left in place for 6 hours after coitus. Protects from STD, HIV, can be reused. शुभम, वो सोशल मार्केटिंग स्कीम होता है ना बिहेवियरल चेंज के लिए. एंड सच देर आर मशीन्स विच आर डिस्पेंसिंग OCPs, condoms और मिनिमल प्राइस. ठीक है, दे आर नेक्स्ट टू एयरपोर्ट्स, रेलवे स्टेशंस. माला डी एंड ऑल दीज विल नॉट बी इन द सब सेंटर. वहाँ तो माला इन होगा, फ्रीली मिल रहा है. Okay, but next to airports, railway stations, we can have vending machine, like we have condom vending machine which provides condom at minimal price. उसको बोलते हैं social marketing. ठीक है? What is the answer to this? Protects from STD, HIV, not at all. Today is vaginal sponge. It does not protect from STD, HIV. It contains spermicide, non-oxanol 9,000 milligram. It has to be inserted at least 2 hours prior sexual intercourse. It has to be left up to 6 hours after coitus. Okay, the person, if she forgets to take it out, can die due to toxic shock syndrome. within 24 hours if not taken out, of course it can be reused. Vaginal sponge can be reused, guys. Look over here. This one is a vaginal sponge and this came in NEETPG exam. The image, a V-shaped band. This is available by the brand name Today. These are what? These are male condoms. What are these? These are female condoms, the one which has 2 rings. Female condoms are provided freely under National AIDS National AIDS Control Program to commercial sex workers. They have 2 rings. First ring, inner ring will go and cover the cervix, outer ring lies outside the vulva. They have higher failure rates, but they protect from STD HIV. Protect from STD HIV. And this one, this is a cervical cap. This one is a cervical cap or diaphragm. This has a lower failure rate than vaginal sponge. Otherwise, everything is the same. Diaphragm also does not protect from STD HIVs. It can be reused. It has to be left in place for 6 hours after ejaculation. Okay. So this is, but cervical cap has lower failure rate. Alright. Lower failure rate. Dutch cap, whatever you want to say. Alright. Quick question on emergency contraception. Which of the following is not an emergency contraceptive? Bolo? Ulipristal, mifepristone, levonorgestrel, desogestrel. Guys, desogestrel can be used as a contraceptive but not as emergency contraception. Alright, so you will not say desogestrel is used as an emergency contraception. No. Emergency contraception, if you have to just quickly know the names, guys, we have USP method. We used to have USP method earlier. This is combined OCP. Alright, ulipristal, selective progesterone receptor modulator, 30 milligram single tablet taken within 120 hours of unprotected sexual intercourse. Mifepristone is more important and anti-abortion drug. For emergency, the dose is now 10 milligram. It's been updated. Should be used within 72 hours. IUCD, best can be used up to 5 days. Can be used up to how many days? Up to 5 days of unprotected sexual intercourse. But which is the most preferred? This is the most used. Alright, this is iPill, a single pink color tablet. You can also call it as Easy Pill. You can also call it as Unwanted 72. Alright, and this has to be taken within 172 hours of unprotected sexual intercourse. ये एक सिंगल टैबलेट है 1.5 मिलीग्राम का. ठीक है. MTP एक्ट क्या कहता है? अकॉर्डिंग टू MTP एक्ट, रिमेंबर, for contraception failure, MTP allowed only up to 20 weeks. Please read MTP Act and go. It's very important. Allowed up to 20 weeks. And that too you can go with one doc. 2 doctors MTP Act में कब लगते हैं? 2 doctors in MTP Act, it is between 20 to 24 weeks. Up to 20 weeks we can go for with one doctor. ठीक है? So emergency contraception. Okay. Bonus question, absolute contraindications. Let's quickly revise. IUD are all except. What is your answer over here? Pregnancy, yes. Undiagnosed vaginal bleeding, PID. Uterine malformation is relative. Absolute is cancer. Cancer of the endometrium. Alright, cancer of the endometrium. ठीक है, why? Writing B. Vagina से bleeding absolute है, guys. Let me show you. I think I might have a table. Look over here, everybody. Read. Absolute suspected pregnancy. Relative, you have to be careful. Anemia. Menorrhagia. Alright, menorrhagia. They are all relative. PID. Current PID. यहाँ पे क्या है? History of PID. Vaginal bleeding, यहाँ पे cervix से discharge. Over here, cancers of cervix, uterus and all that. Here, distortion of uterus, congenital malformation, fibroids. Unmotivated. And relative is now previous ectopic pregnancy. Previous ectopic pregnancy. So that is what? Relative contraindication. Okay, remember this absolute and this one. हाँ, contraception failure में MTP 20 weeks. उसके बाद due to other reasons it could be 20 to 24 weeks. Previous ectopic pregnancy, Seerath, relative. Alright, tell me this one. Which out of the following IUDs are provided freely under National Family Welfare Program? What is your answer? Just tell me A, B, C, D. कौन से freely मिलते हैं National Family Welfare Program में? Can anyone tell in the comment section which IUDs are being provided freely under this thing? Freely under the program. What is it, guys? Very good. This is Copper T 380A. This has a shelf life of 10 years. 380 is the surface area of copper wire. This is Copper T 375 or multi-load. Alright, U-shaped blue color copper wire. This one and this one are provided freely. This one is Nova T. What is this? Copper T 380 AG. It has a silver core in it. Shelf life is 5 years. A silver iron reduces inflammation. 375 का भी शेल्फ लाइफ 5 years है. और ये जो है दिस इज LNG 20 levonorgestrel 20 और Mirena releases 20 microgram levonorgestrel per day. This has the lowest failure rate. It is not provided freely. It has to be bought. It is not provided freely. Alright, so what are the ones provided freely? Option A and option C. Copper T 380A, Copper T 375. This one's your Mirena, guys. Okay? इसकी shelf life अब 7 years हो गई है. So you could be asked 5 to 7 years. It has synthetic progesterone 52 milligram releasing 20 microgram every day. This is Progestasert. This is Progestasert. This shelf life is 1 year. Alright, and this has the lowest expulsion rate. It doesn't come out very easily. Lowest expulsion rate. What is the ideal time to insert a IUD, guys? Best time to insert copper T. Best time to insert IUD. Please remember is during menses or within first 5 days. During menses. Alright. But most receptible time. Most receptive when the couple is going to, when the woman will say please put an IUD because she doesn't need anybody's approval. Alright. Most receptive is within 48 hours delivery or after 6 weeks. After 6 weeks. Okay? You will never give it now between 48 hours and 6 weeks. अब या तो within 48 hours या after 6 weeks. Therefore, if somebody asks you contraception of choice in a breastfeeding women, if I ask you breastfeeding woman within 6 weeks of delivery, what is your answer? Within 6 weeks of delivery. Contraception of choice in a breastfeeding woman within 6 weeks of delivery. Earlier it was copper devices, IUCDs, but now we can give IUCD only within 48 hours, yeah, after 6 weeks. So if somebody needs it within 6 weeks of delivery, POP. Progesterone only pill. Second choice is Chaya. Second choice we can go for Chaya, Centromin, but the first one is POP. POP can also be prescribed to older women. If there's a, let's say, 40-year-old woman and she wants a pill, you can't give her combined OCP because of heart problems. So you can advise her a progesterone only pill. These are very important points, guys. Within first 6 weeks of delivery, you will go for progesterone only pill. Okay? Okay. Let's quickly calculate Pearl index for 10 more minutes. What is the answer to this? Out of 100 women who took OCPs for contraception, 10 women got pregnant within 24 months. Okay? So, what is the answer here? One second, guys. Just give me one moment. Hello. लिखा आंसर ठीक है. Pearl index, we all know, is to evaluate efficacy of a contraceptive method. Evaluate efficacy of contraceptive method. Evaluate efficacy of contraceptive method. What is the formula for Pearl index? Number of accidental pregnancies. Number of accidental pregnancies. Number of accidental pregnancies divided by the total months of exposure, divided by the total months of exposure, multiplied by 1200. What is 1200? 1200 is the number of months in 1200 is like we always express in 100 woman years. So 1200 is number of months, all right, in 100 years. In 100 years, एक महीने में 12 months, so 100 years में 1200. Now accidental pregnancy, 10 women got pregnant, so 10. Now they have taken for 24 months, 2 years. So what is the total months? 24. But how many couples have taken it? 100. So you will multiply it with 100. So how much does it come to? It comes to 5 per 100 woman years. That means if 100 couples used it for 1 year, 5 would get accidentally pregnant. ठीक है, never forget to multiply the total number of couples who are using a contraceptive, and trust me, there will be one option in which they will just have 10 by 24 into 1200. नहीं, you have to multiply with the number of couples. Most commonly used is Pearl index. Okay, most commonly used index is Pearl index. But suppose question आ गया, which I had taken in short INICT sessions also. Best measure to evaluate failure rate of contraceptive. Best measure to evaluate contraceptive failure क्या है? कॉन्ट्रासेप्टिव फेलियर असेस करने के लिए व्हाट इज द बेस्ट मेजर? गुड, दैट इज लाइफ टेबल एनालिसिस. वी विल नॉट गो इनटू डिटेल ऑफ दिस. इट टेक्स द इंडिविजुअल मंथ्स ऑफ एक्सपोजर. इट कंसिडर्स अ कपल फॉर हाउ मेनी एग्जैक्ट ड्यूरेशन दे आर यूजिंग द कॉन्ट्रासेप्टिव. जैसे इसमें वी हैव केप्ट अ फिक्स्ड, ऑल राइट, 600 मंथ्स हमें देखना होता है, ठीक है, बट वहाँ पे वी कंसिडर इट फॉर इंडिविजुअल मंथ्स. Dolls and Hills would be a cohort study. Janvi, please correct it. Dolls and Hills is a cohort study. Dolls and Hills is a cohort study. ठीक है? Alright, couple of more questions to go. Quickly answer this. A 36-year-old woman presents to a clinic seeking contraception counseling. She is breastfeeding mother of a 2.5-month-old baby. She reports history of heavy menstrual bleeding. What are you going to advise to her? What are you going to advise to her? What are you going to advise to her? इसमें कैच है, ये देखो, 2.5 month, okay, progesterone only pill, but heavy menstrual bleeding occurs with only progesterone, like injectable DMP presents with irregular bleeding. Implants, irregular bleeding. Whatever has only progesterone can complain of irregular bleeding. So what will be my second choice over here? Centroman, not POP. The answer here was centroman because the woman is presenting with heavy menstrual bleeding. In heavy menstrual bleeding, we need to avoid POP. That is, like if nothing was mentioned, if this line was missing, she reports history of heavy menstrual bleeding. If this was not there, your answer would have been POP. But heavy menstrual bleeding is you would say it's a problem with contraceptives that contain progesterone. Okay, so what is the second one? Centroman. So over here, let me show you centroman first. This is centroman or chaya. This is now available by the name of chaya. This is once a week pill. Earlier it is used twice per week for 3 months, then once a week pill. And this is a yes, it is a selective estrogen receptor modulator. So this is now provided freely by Government of India. Tell me answer to this. Remember, progesterone component presents with irregular menses. Therefore, वहाँ पे answer होता. Yes, centroman Saheli is the same. Earlier we used to call it Saheli. Now it is Chaya. What is the answer to this? A sexually active woman is using Antara. Which of the following is the correct dose? Now, Antara is nothing but 150 milligram intramuscular every 3 months. So, Antara is nothing but injectable DMPA. Two friends, guys, Antara and Chaya, have been introduced freely till subcenter level. ये तुम्हारा Antara है, ठीक है? This is important. Okay, Antara and Chaya done. Choice of contraception in women with heart disease. What are you going to mark? हार्ट डिजीज में क्या दोगे? Yeah, choice of contraception in a woman with heart disease. Okay, now again we are just asking heart disease. So heart disease mein you can't give OCPs. You should avoid anything which has this. Then again, all right, go for lower failure rates. Okay, so the lower failure rate IUCD का होता है या condoms का होता है. Choice of contraception in women with heart disease. No, you don't need to go for injectable DMPA, guys. Now heart disease is mentioned, so what is the best thing that you should do over here is you can go and what have you written over here? Answer, yes, you can just go and advise her for a IUCD considering lower failure rate. Alright, what is the answer to this? What is not included in the scope of modern concept of family planning service? Modern concept of family planning service: screen HIV infection, sex education, education for parenthood, providing adoption services. So what is not in the scope of modern concept of family planning services, guys? स्क्रीनिंग HIV क्यों करोगे फैमिली प्लानिंग में? स्क्रीनिंग HIV इज अ पार्ट ऑफ होम. स्क्रीनिंग HIV infection, sex education, education for parenthood, providing adoption services. Yes, screening HIV is a part of NACP. We are not taking it in family planning services. Adoption service फिर भी बात आ जाती है, ठीक है. Somebody is not able to conceive, but if you have to talk for HIV screening, why will I do it under family planning? ठीक है. Postpartum sterilization as per Government of India should be performed within. What is the answer to this? Within 48 hours to 7 days of delivery. ठीक है, within for not 24 hours, within 48 hours let the the inflammation settle down. Now nobody first vasectomy or tubectomy, what is the cut or like what is the eligibility criteria? One child more than 1 year age. One child more than 1 year age eligibility criteria. No approval from either the, if a man decides to undergo vasectomy, doesn't need approval from the wife. If the wife decides to undergo tubectomy, no approval. Now after vasectomy they need to use barrier method for 3 months. Use barrier method for 3 months, or they have to at least use barrier method for 3 months or 20 ejaculations free. Remember this, 20 ejaculations free. ठीक है? Yes. What is the answer to this? Delayed immunization in case woman on OCP forgets to take pills on 3 consecutive days. What should she do? Should she pop in 3 pills immediately? Take 2 pills each for the remaining cycle. Take 3 pills the next day and continue with 1 pill per day. Use barrier method for the rest of the cycle. Continue with the next pill the next day onward. What are you going to mark over here? Ideally barrier method next 7 days tak use karna chahiye. You can't pop into 3 pills altogether. Okay, now over here the question, see, I will just take you to the explanation. If you miss management of missed pills, all right, management of missed pill. If you miss 1 to 2 pills first 48 hours, no problem. Take 1 pill as soon as possible or take 2 pills at the scheduled time. No risk of pregnancy. If more than 3 pills are missed in the first or second pill, in the first or second week, okay, you will take 1 pill as soon as possible. Continue with the scheduled pill. Use barrier method for next 7 days. In case of unprotected sex in the last 72 hours, use emergency contraception method. But if you miss 3 pills in the 3rd week, in that case, as soon as you remember, take 1 pill. Finish the hormonal pill, but you are going to discard the last 7 pills which are non-hormonal, have to be discarded. Use barrier method for 7 days. Week mention nahi hai, bilkul Anshika, week is not mentioned here, but then since it was 3 pills, out of those options, what is the most suited one is, what is the most suited one over there? The most suited one over there is, because the week is not mentioned, so the most suited one any which ways is barrier method. ठीक है, इसमें कुछ मेंशन नहीं था वीक वगैरह, बट यूज बैरियर मेथड बिकॉज इट इज 3 consecutive days. All right. Okay. Non-contraceptive benefit of OCPs to a woman are all except non-contraceptive benefit. It protects from, it doesn't protect from cervical cancer. I'm just writing it for you. Yes, vasectomy 7 days, tubectomy 14 days. Chalo, I think that's it. Okay, 3 more questions. Give me the answer. This is non-contraceptive benefits. So we know non-contraceptive benefits of OCPs, benign breast disorders, PID ectopic, where I cannot give IUCDs, I will use this, ovarian cancers, endometrial cancers. Okay? Last question. Can you calculate the couple protection rate over here? Can you calculate the couple protection rate? A village has 180 eligible couples, out of which 10 couples use OCP, 29 use condoms, 10 couples use IUCDs, 3 use vasectomy and 8 tubectomy. So what is couple protection rate, everybody? How many contraceptives the couples are using? How many are protected? So eligible couples 180 है, जिसमें 10 use OCP, 29 use condoms, 10 couples use IUDs, 8, 9, 10, 11 use vasectomy and tubectomy. So you can just add that up and you will get your answers. So will you be able to solve this? I haven't solved it. Please solve it yourself. You just have to add everything, divide by 180. 33.3. You sure, Chandra? Okay, 33.3. Why to discard? What are we discarding? Oh, non-hormonal, because the risk of failure is more. So we have to discard those non-hormonal pills. Last question, target couple. Target couple क्या होता है? Currently married couple where the wife is in the reproductive age group, couples using contraception, couple with children, eligible couples who have 2 to 3 living children. Earlier we used to use the word target couple. Now we use the word eligible. जब target couple था ना, they were eligible couples who have 2 to 3 children. But later we realized it's not currently married couple. This is the definition of eligible couple, guys. Everybody is answering A. Silly mistake. This is called silly mistake. Guys, eligible couple is currently married couple where the wife is in the reproductive age group, or even if you don't use the word currently, married couple. Anyone who is newly married, anyone who has 2 children, anyone who has 3 children are eligible couples. Before we use the term target couple. Target couple was particularly meant for couples who have 2 to 3 children. Did you understand? Target couple no longer used. It was particularly used for the term eligible couples who have how many children? 2 to 3 children. That was used for target couple. Eligible couple is married couple in reproductive age group. Okay? And remember, eligible couple register is maintained at sub-center. To maintain it, the responsibility lies with the ANM. ये FMG एग्जाम का PYQ है. There are 150 to 180 eligible couples per 1000 population. Shania, for 7 days vasectomy, that was under the benefit. ESI Act में benefit होता है ना, enhanced sickness benefit. That is what we meant by vasectomy and tubectomy. That I will teach you again in occupational health. Okay, in ESI Act. Enhanced sickness benefit. Okay, all right, now just a quick question on Malthusian model. Malthusian model tells you about the population doubling time. What does it tell us? It tells us about the population doubling time. Okay, and the law for it is 70 divided by annual growth rate. Somebody was asking, suppose for a country X the AGR is 2%. When will population double? When will population double? So how are you going to calculate that? You will just do it 70 by 2 35 years. Suppose I gave you it is 1%. When will population double? 70 by 1, 70 years. Malthusian model. Clear? Okay. Low stationary phases, the births are also low, deaths are also low. High stationary se low stationary. Demography, transition. Okay, so that's it for today, guys. ऐसा तो नहीं है. Distilled water, sterile water, you can choose any of it. None of them is wrong. All right. चलो. So that's it for today. Bonus means advantage. So what is the advantage? Dependency ratio decline हो रहा है. Burden means pressure. What is the pressure? Dependency ratio increase हो रहा है. ठीक है. Now bonus is because of low fertility. Now family planning is good. Fewer children are being born. Burden is high life expectancy. Hospitals have improved. Elderly population बढ़ रहा है. It's increasing. That is what is burden. Clear? BCG is normal saline. Yes. He's not at home. I will get him one day. Okay. No contraceptive methods. I've told you guys. Contraception of choice, breastfeeding, first 6 weeks of delivery. It is progesterone only pill. Contraception of choice, long distance relationship. Long distance relationship में contraception of choice will be IUCDs. Alright, because of lower failure rate. But ये adolescents को contraception of choice बताना है barrier method. ठीक है? So some newly married healthy couple OCP. ठीक है. चलो फिर मिलते हैं कल. Tomorrow is a very important day. Biostats, do the quiz at 8 p.m. today. We will discuss this. Menorrhagia, OCPs are useful because OCPs में you have iron tablets, so they are of help there. And please remember in OCP जो iron tablets होते हैं, they are of ferrous fumarate. Ferrous fumarate. In anemia मुक्त भारत, they are ferrous sulfate. Yeah, you can. Okay. So I'll see you tomorrow. After floods, it is best to give doxycycline tablets. You can spray malathion. Don't go and spray rodenticide. Zinc phosphide spray नहीं करना है. ठीक है? After disaster, you can give doxy. You can spray malathion. ठीक है? So I'll see you. Bye bye. Take care. Have a good day.